Hi, welcome to Pivotal Practices. We are back, and I am so excited because Margaret's back today. Everyone hopefully remembers Margaret if you've seen previous podcasts. But there was this need that was revealing itself through clients and patients. And so we're going to dive into some really interesting subjects surrounding counseling and surrounding resiliency and your ability to also notice spiraling thoughts. And so we have a lot that we want to pack in today, but we're super excited to be with you. And then I'm just going to also still have Margaret give a little bit of her background in case you're new. And so I'll just introduce Margaret to all of you.
Hi.
It's so good to be with you
It's good to be here
again.
again. Yeah, thank
Yeah.
you. Um, I have been in private practice for, probably over 20 years. I have a history as well in working with the dying. Did some hospice work for a few years, 20 plus, and did that while I was doing my private practice. And it's been a really wonderful personal and professional growth time.
Mhm.
I really love the work. I love seeing clients get better and heal and really come to some internal revelations, really, about their life and their meaning and developing new skills to move forward and heal. Yeah,
Wow.
love it.
Very cool.
hmm
You also, to me, specialize in like individual counseling to help people with their own lives and also to like impact their relationships in a better way.
Well, because we know that if we're not regulated well, right, it doesn't it affects us internally with conflict, but it also affects our relationships and our view of the world. And
Mhm.
so when we talked at our last podcast about forgiveness, it is that way as well. When we have some intrusive thoughts that make us feel anxious or worried, it doesn't affect us internally well, nor our relationships. And so I do a lot of individual work with people struggling with mood disorders. I do a fair amount of work as well with couples who are struggling with these very things. How do we communicate in a healthy way? How do the individual needs collectively impact the we space?
Mm.
And so the couples work is also really profoundly impactful for me to do. hmm
Very cool.
hmm
Yeah. So, one thing that I'll just add for some reason I feel led to say this is like some scaras, which are wounds, come up as we get into even healthy relationships.
hmm
And so it's natural at first sometimes for the triggers to happen, but they're coming up for our healing.
hmm
And so that actually could take us right into like, when do we recognize, when do we realize that we need counseling?
hmm
Like, what would be the signs or the things that we begin to notice that says, I really need to find a counselor?
That's a great question because I think that individual journey is very personal. Sometimes in life, and I agree, triggers show up. We're going to talk about this later in the presentation. That whatever shows up currently is a growth opportunity, right? It reminds us that even though I may have done some individual work to manage my emotions related to an event or a person, when things show up in the current, it just means I need to attend to it. I need to revisit it. And so when you're feeling anxious or worried and you're struggling with how to control the worry, and I can't seem to achieve the goals, personal or professional goals I really desire because I can't regulate inside,
Mhm.
I think it's time to see somebody and talk through that. I also think that if you're in a relationship, when you find um, some common patterns of distressing communication patterns or thought patterns, I think then in order to change those, and we really honestly can't do this on our own, we're not sure how to do it because we don't know what we're dealing with. So I think when it gets to a point where you're feeling distressed and
Mhm.
can't manage, and it's impacting our sleep, and our ability to function in the way we want to function. And that's really subjective. And so if I am struggling with attention and follow through, then I think it's time to see somebody.
Mhm. Yeah, I would. One of the things that is true is, they prepare us in school for, let's say, math class and English. But what really I believe most children need and what most parents should be giving their kids are ways to cope with life, deal with hardships,
Mhm,
because life
mhm,
will bring unexpected hardships,
mhm,
stressors,
mhm.
resiliency, what it means to actually be in a relationship and what does a healthy relationship look like. So, what I'd ask you is, how do you know when you're looking for a counselor, like what kind of counselor you need? And at the same time, and you take your time with each question, how do you know if the counselor is being effective, if the relationship is really moving you through trials and
Mhm,
helping you get better?
mhm. Well, I think whenever you're starting a relationship with a counselor, it really is a very intimate relationship.
Mhm.
It's one where you need to feel safe, where you need to feel heard and validated, where you need to feel challenged, really, both in the way I think about something and the way I'm choosing to respond to something. And we're going to expand on this later, but choosing a therapist that is able to meet your needs in that way. I think it is a shared responsibility. So if you want to see somebody who has a history of some trauma work, because that's something that you're wanting to deal with, please make sure that person is trauma informed. And when you're choosing a therapist, those are the kinds of questions you want to ask. What is your theoretical basis? How do you handle conflicts in session?
Mhm.
How do you see each other's role? And we're going to talk about what those expectations look like and how do you set those. For me, for me as a therapist, I appreciate feedback.
Mhm.
I It sounds primitive here, but I don't know what I don't know, right? So if I'm being maybe too direct or not direct enough, and you need either one of those, I explain to clients all the time, please share that information. I think it's helpful for the therapist to know not only what you need, but how you need it delivered, because I think those two are so intertwined and they both are impactful in the way we receive information. So I think it's one of these things where you need to be clear their theoretical background. If you're looking for somebody that does substance abuse, you don't want to look for somebody who just specializes in mood disorders, for example. If
Mhm.
you're looking for somebody who can help you through some trauma, you want to make sure they have some training in that area. So, and you can ask those questions, and I often do consults with clients before they even show up in my office to make sure that what they need is something that I can help them with and vice versa. And then I think when we get into how do you know it's not a good fit, right?
Mhm.
When those things don't happen, when it's been clear through the therapy time together that your expectations haven't been met. And that goes back to how do we set those expectations, right?
Mhm.
I think for me, it's important to know what the client wants to achieve. And so, how do we do that? After I take a significant history and we talk about what has led them to my office, what is the presenting symptom or problem, then we talk about how can we establish a treatment plan. And the treatment plan really is a very individual plan. I do it with clients routinely, and it's just a way for the expectations that I believe are shared in therapy to be kind of spelled out in a way where everybody knows who's responsible for what. Here's the plan. The care plan is sort of like our roadmap moving forward.
Mhm.
And I do mine with goals and objectives that meet the client's needs based on what is presenting. Now, I would say more often than not, the care plan is just the beginning, right? It's like what shows up on day one may be different than what shows up maybe in week 15. And so it's
Ah.
fluid. It's meant to be changed as the client's needs change. And we talk about what the original goals or objectives were and where we are now. So we do a routine check in along the path to moving forward. And that to me, I think is the clearest way for clients to understand who's responsible for what in therapy.
Yeah, we were talking about this earlier. So, if there's any, even as a body worker or as a counselor, if there's anything that you're trying to achieve, you want the right practitioners. You need to feel a bond with them. You need to
Mhm.
feel like they're the right one. Mind you, that also means that you're going to get constructive feedback that you need to take as an adult. That's important. Like, that's important for our changes. We need to hear our weaknesses, our
Mhm.
strengths. But at the same time, you have to co-labor with them. Like, you have your
Mhm.
own responsibilities. Like, you need to get on the table if you need the work, right? Or you need to show up to their office or attend to
Mhm.
your actual sessions and not continue to neglect them. Changes can't happen without you co-laboring and doing your
Mhm.
part, whether it's in the room, but also taking the practice outside.
Well, and really, Teresa, I think and I say this to clients all the time, the work of healing
Mhm.
is not for the 50, 60 minutes we spend together once a week. It's about taking the tools that we're learning and practicing in session and mastering them, fine tuning them in between sessions. And that's the part I sort of explain to clients. It's like if you have a knee injury, right? And you go to a PT or an OT to rehab, this is emotional rehabbing, right? It's like the therapist will give you exercises to do at home between sessions to make things stronger, and to achieve the results that you want. I view my role very similarly
Mhm.
in the work that needs to be done, both from a session perspective and then what do we do outside a session. And I think your point's well taken. I think, and I say this all the time, that if we have a hard session, right, if it really is quite frankly terrible, like that's not a reason to not come back, right?
Mhm.
The reason to not come back is that you're feeling wonderful and consistently wonderful, and that you're feeling happier. I don't know if happy is achievable, but happier, healthier.
Mhm.
But sessions can be really hard sometimes. And that just means, again, back to what you initially said, when a trigger or a disturbing thought show up, it just means I need to attend to it again. And that's hard to do. And it means really becoming vulnerable and clear and sort of raw in session at times. They're not always that way, but with discomfort comes growth. And there
Yeah.
really is no other way. But I view it as really a gift, quite frankly,
Mhm.
because sometimes that's the only time growth occurs is when there's this distressing event and I realize, oh, I can't do this anymore. It's too hard. It's coming more frequently and more intensely.
Mhm.
And the duration of how long these feelings hang out is much longer. And so landing in my office is a gift. I really do believe that. And I view my role as a guide to get clients where they want to go. But that road forward is not so neat and clean. It's muddy, it's hard, but it's beautiful at the same time. Truly.
Yeah.
Hmm.
Yeah. I remember like sometime back when we recorded a different podcast, we were talking about like like okay with being uncomfortable. Like, as an adult, there's a lot of things that are uncomfortable in life, but the more you stop trying to have aversions to what's uncomfortable and you just receive it instead of looking at like a trial or this is a problem. I always say, like, don't always look at it as a problem. Look at it as something that you're going to grow, that you're going to learn,
Hmm.
that you're going to become a better version of yourself. And then we did talk, and counseling will help your relationships, but well, I remember we laughed so hard when I said, everybody thinks I'm going to counseling to complain about everybody else and all the people that cause me all my problems. Counseling is going to perfect your reactions inside of yourself, help
Hmm.
you know your boundaries, become a better communicator, also learn how to assess whether or not certain friendships or relationships are even worth
Hmm.
holding on to and are even healthy for you. And that part we do laugh because it's like that's what you realize when you start going.
Hmm.
What are these reactions from? What past things brought these
Hmm.
on?
So it's interesting because when we talk about the ways a therapist can help, right? What are some common goals of therapy? Heightening awareness to what is happening in front of me, right? What are these patterns of thoughts that are distressing and what are those triggers, right? So heightening
Mhm.
awareness is kind of the first step to filtering out what is happening currently, right?
Mhm.
And I think then to dovetail with that, we talk about emotional regulation. How do I manage my response to triggers? And your point before with children, if we don't teach our kids that life is sometimes painful and that it's messy, and but yet through the messiness if we allow kids to be uncomfortable, to understand that not everybody wins, right?
Mhm.
And not everybody gets a ribbon and not everybody gets whatever it is they wanted, that life isn't always fair. We're
Mhm.
preparing them to be responsible, um, more balanced adults, right?
Yeah, and emotionally mature.
Mm-hmm.
Man, you can have as much knowledge and wisdom as you want, but if you can't have
Mm-hmm.
emotional maturity and you can't behave in a manner that actually is like balanced and learn how to handle life, it's only going to take you so far. Yeah.
Well, and I say to parents all the time, I would rather we teach our children in the support of our families
Mhm.
how to manage when we fail. And I think the part that we don't often see is that when we rescue kids from distressing events, it's really about our discomfort rather than their discomfort. We
Mhm.
don't like feeling like we can't save our kids, right? But it's not our job to save our kids. It's our
Mhm.
job to raise them to be responsible adults. And if we let them struggle, what the hidden beauty of that is they build resiliency, they build confidence, they learn how to grow. And they understand, okay, when this scary feeling shows up, I did it before, I can do it again. But if they never get to a point where they achieve it because somebody's always interfering and rescuing, they don't build that confidence. They don't build that resiliency. They end up getting
Yeah.
forced to do it, quite frankly, but that's really not the way to build it.
Yeah. So I can give a solid example of what you're talking about because this was a conversation. Like, I have an amazing client, well into her 70s. And mind you, in your 70s, you can't help when you start having grandkids. Like, if your kids decide to have kids later in life, you are a much more older grandma and you don't have the energy to give or to watch those kids as much as if you were maybe in your 50s,
Hmm.
right? Or 60 years old. And so she keeps stepping in more because she says she can tell her kids are handling all the work and the spouses aren't doing their part. So she keeps rescuing. And I said to her, your body's suffering because of it. You
Hmm.
cannot babysit that much at
Hmm.
this age. It's hurting your body. You can't stay healthy. That's your responsibility. Your kids need to accept how old you are and that you actually need to take
Hmm.
back more, but
Hmm.
you're also stopping them from actually facing their difficulties in their marriage and addressing it. And you're
Hmm.
enabling the problem to continue. That's a hard lesson, but we've had such a long-term relationship. I was saying it out of love. It's like, that's the thing I think sometimes people need to realize. We can accidentally enable because we come in to rescue too much.
Hmm.
And then
Hmm.
people can't solve their own issues and
Hmm.
let those relationships go further.
And very quickly, the boundary gets distorted, right?
Mhm.
Where my responsibility starts or ends in yours if I'm the grandmother, right? There
Mhm.
isn't really a boundary. I'm just in doing. And before I know it, my body is failing. It's the brain body connection that, I say this in a funny way, but true, seriously. Like if our mind had its way, it would run our body into a hole. But at some point, the
Mhm.
body literally, and you know this from the work you do, stops us dead in our tracks. Whether our mind wants to go, our body says no more. It's the stress, it's the emotional distress that we feel that has its impact on our bodies. And part of what I do is educate clients about that. How do we, when we're talking about emotional regulation, we're talking about how do we handle an intense feeling that's showing up and how do I regulate myself through it? So how do I, if I'm being triggered and this isn't a good space for me to be in because I'm impulsive, I'm reactive, how can I regulate back down to a more thoughtful space
Mhm.
to have a different choice as to how I react? And, breathing, um, we talk about self-soothing behavior, like, um, tapping, the brain body connection. There's all kinds of ways we physically can do that. But I think when it comes to families, if I'm jumping into rescue, I'm going to guess her body was telling her to slow down, but she just ignored it, right? And then it
Mhm.
gets to a point where we absolutely cannot ignore it any longer, and people end up sick, or
Mhm.
or or they end up hospitalized, or something occurs, or people fall because they just didn't see the obstacle in the way because their mind is somewhere else. Those are the kind of accidents that happen, in my opinion, as a result of emotional distress and not
Mhm.
coping well. And so again, going into what do I do? what are the expectations one should expect in therapy is learning how to cope, right?
Mhm.
How do I change the way I view a circumstance to allow myself a better choice? And it could be anything from changing the way I communicate if I'm the grandmother with my son or my daughter to limit my involvement, right? It just
Yeah.
could. I understand that when I'm used to doing and it's expected that I do, it's hard to then pull back and have a healthier boundary and use, again, communication skills, which I help clients develop, to verbalize that in a way that comes from a loving place, not a frustration place that is
Mhm.
edgy and aggressive. That is the lack of impulse control. That is somebody who's dysregulated in a conversation.
Mhm.
And so being able to set a healthier boundary from a loving place, is part of the communication work I do with clients, as well as how do we cope with the feelings that I don't really like right now.
Yeah, I would agree with you.
Hmm.
Um, so let's dive deeper into, because what has been coming up for some of my clients is like spiraling. Like when they get triggered, it's almost like they the mind ends up spiraling and for days at a time, and they feel distressed, and the situations, and I'm not at all downplaying the pain or the emotion, but the situations that they're talking to me about, um, they clearly need a little bit more counseling or work because their ability to regulate that is
Hmm.
not there. It shouldn't go on all day and for
Hmm.
days. That is torturous for your body and your mind.
Yeah, and teaching a client how to be more aware, right? We talked about self-awareness initially. Like one of the tools I use with clients is, again, when you're in a circumstance. So I have them describe a circumstance that's distressing and how do they react in that. And then I back them up to understand what was your body telling you along the way to
Mm,
slow down. Because if I could, if so 0 to 60, and 60 is I'm totally dysregulated, either I'm overengaging in a way that's unhealthy, my body's responding in an unhealthy way, or I shut down, right? So either one of those extremes isn't good for my brain or my body, right?
mhm.
So when I teach clients how to pay attention to their body and what it's trying to tell them, you give them an insight and a tool that in the very moment when their mind wants to spiral, how do I slow it down to allow me to use the coping strategies that we can talk about? And recognizing, so if I could describe it this way, distress tolerance is my ability to understand that intense emotion at the moment, right? I'm feeling something, it's distressing. How can I label it? Can I give it a name? Can I understand it, right?
Mhm.
So it's more the emotional piece. I would say emotional regulation is more, so distress tolerance is more the understanding of the emotion. That's distress tolerance. Emotional regulation is how do I respond to it? So what do I do with this, right?
Mhm.
I feel this. We can talk about how do I radically accept it, acceptance, right? So I'm in a circumstance that I'm not sure how I got there, but I can't in that moment change the circumstance that I find myself in. I have to change my thought process about it to be able to slow my processing down so that I'm not then dysregulated emotionally and responding in a way that
Yes.
doesn't make sense. Does that
That
connection
does
make sense?
work. I also too, like, let's say the person starts realizing they need counseling, because I was saying that to a couple of them. The counselor can then, through you being open and speaking and them hearing the triggers and what's happening to you, come to pinpoint the possible trauma that
Mm-hmm.
has really happened that is allowing this 10, 20 years later.
Mm-hmm.
So, like for one of them, it was abandonment
Mm-hmm.
issues, which is really quite a trauma,
Mm-hmm.
that can trigger things later.
Mm-hmm.
Um, but also, like one thing, even through counseling and emotional regulation, is you cannot control other people. That is
Mm-hmm.
such an important thing to realize. As you're having your triggers, they're for you to work through. Other people can't solve what's internally happening in you. Do you know what I mean?
Mm-hmm.
You have to have the tools and you have to do the work. It's hard to, like, when the mind gets too spiraling, then sometimes scenarios happen in your mind that are not even real, and you
Mhm.
over complicate and over dramatize
Mhm.
unintentionally.
Unintentionally.
Yeah.
And when I'm unaware of the process of how I got here, when I am so dysregulated, I can feel like this is real. Like my distortions of the event or of this person is real
Mhm.
when it's a feeling, not a fact. And so when I am so dysregulated, my feelings become much bigger than is applicable to the event. So if I'm in a relationship and we're having a conversation, and all of a sudden some words that my partner said or a parent or a sibling or a friend triggers me, and all of a sudden now I have a whole slew of, I call it flooding, like a whole slew of emotions that are bubbling up. And I suddenly now I'm responding in a way where, if here's the event, my response is really an overreaction to the event, because
Mhm.
it's not about the event, it's about all of this other stuff from my past, the trauma, abandonment, rejection that's showing up here. And so being able to slow down and truly regulate through something like that. And how do you do that? You breathe, you pay attention to what I'm feeling. I will ask for clarification from my partner. What did you mean by that? This didn't feel right. Rather
Mhm.
than just responding, I'm going to slow down and breathe. I'm going to have, I'm going to engage in a different way rather than over engaging or shutting down, because oftentimes that happens as well, where I just disengage disrespectfully, right? I'm
Mhm.
going to pause, slow down, and breathe, which then just allows my brain to stop firing so quickly.
Mhm.
Again, now I can be more thoughtful and more in tune with what is really happening here, not what I'm feeling is happening here.
Yeah.
And I can engage in a different way. I can ask my partner for clarification or for a different understanding about what was just said. And what I realize in that conversation is I'm staying connected. I'm asking for clarification. I'm not responding in a way that doesn't align with my values, right? When people are dysregulated, it's not just an outward conflict and problem in a relationship, but it's an internal conflict as well, more importantly, because I feel like like if I say I'm a kind, loving person,
Mhm.
but the way I just responded in that circumstance was incongruent with that, right? I responded in a aggressive, um, snarky, really mean, edgy way,
Mhm.
which isn't who I am. But
Yeah.
when I allow the feelings to guide my decision making rather than the facts driving my decision making, I often end up dysregulated.
Yeah, it's a defensive response. It's
Mm-hmm.
a very, like, you're feeling offense because of what's going on inside, and like your reactions are not with the most integrity or in a grounded way, like a sensible grounded way. Um I I forgot the one thing that when you're talking about that, I was thinking about, but one of the things that I know I wanted to bring up is, what's also really important for like emotional regulation is you have to not act like a victim. When we start acting like a victim, there's a difference between me sharing with somebody I trust and releasing and somebody hearing my story. So I feel like I'm being seen and heard. That's
Mm-hmm.
healing. But if I keep ruminating and I keep talking about it to everybody, then I start allowing myself to spiral because I'm
Mm-hmm.
letting that rule my current actual like vibration all the time. And I've heard people actually make excuses, unfortunately, but it's like, well, I like wallowing in my feelings. And it's like, oh, well, then that's the life that you're choosing. You're never going to live in the present. That is a victim mind. And in a victim mind, you will never move forward. You will be sinking in mud. It's
Mm-hmm.
impossible to move forward when you allow yourself to be a victim. Nobody says what happens to us is always fair or that we
Mm-hmm.
deserved it. That is like very true, right? Nobody deserves to be raped. Nobody deserves to be
Mm-hmm.
abused.
Mm-hmm.
But nonetheless, once it happens, you can't take it back. The
Mm-hmm.
responsibility for healing and getting better from what somebody's done to you is yours. Whether you like
Mm-hmm.
that or not doesn't change the truth of it. So
Mm-hmm.
facing it is being more emotionally mature. you know?
Well, and I think when we respond in an angry way, if you think about what is the core of anger, it's a sense of injustice or unfairness, right?
Mhm.
I feel like what happened to me wasn't fair, and in fact it wasn't. So the acceptance, again, remember I talked about radical acceptance, is I don't have to like what's happening here. I don't have to like what happened to me. And by all means, one should never, right? But I am responsible to understand that I can't change that. And if I continue to move forward in a victim mentality or a dysregulated way in relationships, I am choosing, not the event, but I'm choosing to let this event continue to define me in the present
Mhm.
moment, even though it happened 20 years ago, right?
Mhm.
And I think we get to choose. And I don't know that when people start therapy, they understand that they get to let it go, that they can choose to do
Mm.
that. I I understand that letting it go has been distorted. In some ways, people think letting it go means what happened wasn't as profound as it was, or I'm somehow minimizing the trauma. Letting go or forgiving is a choice. We talked about this in that podcast. It's choosing to say, I want to move forward in a healthier way
Mhm.
because this doesn't have to consume me. When it does in an angry way, it distorts everything.
Yes, it
Everything.
frees your body, mind, and soul, when it liberates you,
Hmm.
and it also heals your heart, sets free your mind. Like, there's just so many things it does when we work
Hmm.
through things. Um, Before we go into resiliency, I'm curious, depending on somebody's trauma, do you feel it would matter, let's say, if it's a man, that he would necessarily need to see a male therapist or a woman see a woman therapist? Is there, and I know that's not just always like something where it's a concrete answer, but depending on the trauma that the person
Hmm.
has, do you think that there's feedback you would give to that?
I think it's about your comfort level and what you need to share, right? I don't know
Mm,
often what clients have in them to share that we will be processing through in therapy. What I say to clients all the time is if the gender is impactful in your ability to disclose or feel vulnerable, because it
uh,
is about vulnerability, I view my time with clients as really holy ground. And I can't say that any other way. It's allowing them to feel like they can share whatever it is they're feeling. And that's an incredibly vulnerable state. And if you can think about a trauma victim, being vulnerable meant I was hurt, right? Being vulnerable meant I was attacked. Being vulnerable meant all of this stuff. And now, in order for therapy to move forward extensively, one has to be vulnerable again. And that is a very tricky path. And so if clients feel for whatever reason that seeing a client or seeing a therapist of a certain gender would make them more comfortable, by all means do it.
yeah.
Because what is the point, right? What is the point of seeing somebody that you just don't feel connected to? Going back to our original question about how do you choose and how do you end and how do you manage expectations? If after a few sessions you realize, I really do need to see a female, then I think that's the conversation. It's not personal. I just have to attend to how I feel in that moment. And if I can't, again, for whatever reason, open my heart and my soul,
Mhm.
which is what we do in the healing process, then you have to change.
Yeah. Yeah, I totally agree with that.
And it's an individual choice because I see men and women, and I see couples and I see all kinds of different arrangements of people. And I explain to clients all the time, like, I'm here to help and guide you to where you want to go. But if at any point, and there's many points, it's uncomfortable, but is it uncomfortable because the substance of what we're doing is triggering? Is it uncomfortable because you don't feel a connection? Is it
Mhm.
uncomfortable because you're having a hard time trusting? Because it is a trusting relationship with your therapist, just like it would be with your doctors, right? I don't view
Yes.
it any differently, except when I did hospice work, had a conversation with one of our medical directors about what exactly is it that you do, Margaret, right? They had a hard time understanding.
Oh my
And I
goodness.
kind of said, bearing your arm for a blood pressure to a nurse is very different than bearing your soul, right?
Yes.
It's a very different process of allowing them to be vulnerable with you.
I don't even know. Well, how you could ask that.
Well,
I mean,
I think it's hard for
people
people
are
to,
going through filtering their
yeah.
whole life. They need
Mhm.
somebody to talk to.
I think it's hard in sometimes in a very traditional medical model
Mm,
to understand the benefit and impact of the psychosocial piece.
mm,
And same doctor, I had an argument about, can we please treat this client's depression?
mhm.
And I said, she's dying of depression. She's not dying of any other disease process. It was called adult failure to thrive. And I argued and argued and argued. She finally, sort of, because I'm relentless, just said, okay, fine, we'll do this. Within 6 months, she was eating. She was out of bed.
Ah,
She was connecting with family and friends, and we discharged her. It's like
yes.
that's the part that is so our brains and the way we think and the way we feel um, it is directly connected to how our body feels, good and bad. And so if we're thriving and learning and growing, we are healthier. Our immune systems are healthier, right? Our relationships are healthier. So I think it's really important to make sure that whoever you're seeing, that you feel like you have that connection and that you can really allow yourself to be vulnerable, because without it, therapy only goes so far. And I've had clients who've reached a certain point and they just need to stop because it's too much at that moment. And we stop and they come back a few weeks or a few months later and we revisit things. That's the stopping and the starting is okay. But I don't want you to stop because it's too hard. I want you to stop because you've met your goals in that moment.
Yeah, and sometimes you just need a little extra time to process the sessions that you went through and
Mm-hmm.
incorporate something into action and then come back. Like,
Mm-hmm.
um, it's kind of like I don't always do deep tissue massage, more than once a week. You shouldn't do it more than once a week, right? So sometimes it's like you've gotten a lot to work through and be fed that you need to digest, and you might pause because you need to digest, but you don't give up because you won't go
Mm-hmm.
past it if you don't show
Mm-hmm.
back up. Yeah.
And when somebody is dysregulated, right? When you talk about these spiraling thoughts, you know, um, being in session once a week or once every other week is exhausting in so many ways. And so, part of what I think you can expect from a therapist is, how do I self care along the way?
Mhm.
Because the amount of energy that sometimes, emotional energy, right, that it takes to be vulnerable in session is higher than the energy that I have coming in. And so, what I talk to clients about as we start a journey together is paying attention to what they're doing for themselves outside a session.
Mhm.
And if I'm giving, for example, the grandparent, more energy is going out, and I don't have the capacity at the moment to bring it in, therapy won't work well. Clients will feel exhausted more than they need to feel exhausted, and their immune system will tank. So it's about, what am I doing? Am I connecting with friends? Am I working out? Am I doing some meditation? Am I doing journaling? Am I doing the things that bring me joy while we're doing the work?
Mhm.
Otherwise, the spiraling won't stop if I don't have the capacity, right, to slow it down. And the only thing that gives us capacity is energy, right? Am I bringing it
Mhm.
in so that I can pause when I need to pause, so that I can check myself to say, okay, Margaret, stop going there. That's distorted, that's unhealthy, and replace it with some positive thinking. But if my energy level is always low, it's really hard to do the work between sessions that needs to happen to make people feel better.
Yes, and what I will say is, having taught yoga for like over 17 years now, you don't have to do vinyasa yoga. You can do yin, you can do other forms. Yoga will teach you how to meditate. The proper
Mm-hmm.
teacher, finding the right
Mm-hmm.
teachers, will teach you how to meditate. And it teaches you how to hear your thought responses, to be an observer while the body reacts to postures, and teaches you how to refine it. And I always tell my students, it also teaches you how to notice your body responses, have a body-mind connection, and then when you get trained on the mat and you go off into the world and you have a very extreme situation or something happen, you've learned how to regulate
Mm-hmm.
enough on the mat that you are cross-trained to be able to regulate in
Mm-hmm.
the situation. I think sometimes when people ask me how I'm able to do all the stuff I do. That's one of the things, but I also do the work, right,
Mhm.
to face life. But also keep yourself spiritually fed. What are
Mhm.
you watching when you're triggered? Are you watching a scary movie? Are you listening to very negative music? Like, what are you feeding yourself while you're trying to face and get better?
Mhm.
Also matters, right?
Mhm.
So, what would we also talk about when we talk about resiliency?
So resiliency is really about um, if this is the path I'm on, right? We establish life's going to happen, it's going to be messy, and it will sometimes take us off track. Resiliency is about how do I get back on track again, right? How do I
Mhm.
um, adapt to the changes I find myself in? Again, oftentimes the circumstances we find ourselves in are not of our own making, or they're not things I can change. Resiliency is about how do I adapt to those changes, right? How do I learn from and accept that I'm here? How do I change my view of it? Because the circumstances don't define me.
Mhm.
I get to choose how to respond or how to think about those circumstances. And if I choose a path of beauty and hopefulness, my resiliency and my ability to do it is faster and healthier. If I am, and I think it goes back to the trauma response. Oftentimes we are used to thinking, ho hum, I'm a victim, and I don't say I'm a victim disrespectfully. I say that because I've found myself in this conundrum of thoughts and I don't know how to get out of them,
Mhm.
right? And so if I find myself there, being able to pause, take a deep breath, understand I can't change this, but I also get to choose how I respond to it, how I think about it, which then leads to me having a different response emotionally, physically to it. If I don't like it, it's okay. But if I can't change it, then I need to move through it. Sometimes the clients get stuck in the why is this happening, right? Why
Oh, that's
did I
such a good
respond this way,
point.
right? The
Mhm.
why. And I say to clients all the time routinely, like if the why isn't immediately obvious, move it over here and let's just manage it, right?
Mhm.
Because with distance comes clarity, right? When I can get myself out of it and get to a more hopeful, beautiful, joyous space, I can look back and think, oh, I get it now. I
Mhm.
understand now. It's
Mhm.
obvious here, but it's not obvious when we're in the middle of it
Mhm.
for anybody. And so the why is sometimes helpful, but oftentimes not helpful. We get stuck in the why, and we don't allow ourselves to move through it to get to a place of more settledness. So the answers then come. They rarely do they come when we're triggered. Rarely is it obvious. It could just be Tuesday and I'm triggered,
You
right?
guys are so funny.
Well, sometimes it's not obvious. Sometimes and grief shows up like that, right? Sometimes
Yeah.
it just shows up and it's like I'm in the grocery store.
Yeah.
And so rather than sitting there trying to figure out the why, deep breathe. Let's ground myself in what do I see? What do I hear? What do I feel?
Mhm.
I'm in the grocery store. I'm not back in the alleyway, right? I can get through this. I have the confidence. I'm strong. I'm worthy. I can do this is a way to bring in resiliency when I feel this way.
Mhm.
So I say to clients, chuck the why for a little bit. Let's just get through it. And then it is, I would say it's often obvious later, but it's just not obvious in the middle of it.
You reminded me of what I was going to say. Step back. Step back.
Mm-hmm.
When you are sometimes in the storyline, you can't be objective. So that's another thing in
Mm-hmm.
yoga we talk about. The true mind, not the ego mind, is the one that is aware,
Mm-hmm.
the one that hears the ego mind, the one that is
Mm-hmm.
watching the reaction. Learn to step back.
Yep.
You don't this world will teach you to be rushed, to react now. You have to
Mm-hmm.
make the decision now, and I'm just going to be really open and honest. No decision should be rushed unless you're in an emergency. Most decisions are going to benefit from you stepping back and
Mm-hmm.
tuning in. That's also how you live out your truth and honor your inner spirit
Mm-hmm.
and soul. And when you step back, you then also take yourself out of the situation and allow yourself to ask yourself questions. Do I allow my friends to talk to me this way?
Mhm.
If this was a friend, what advice would I give them? Right? Like those kind
Mhm.
of things that help
Mhm.
you actually like, oh, have clarity and like
Mhm.
make the fog dissipate.
Mhm.
Yeah.
But also going back to, if I'm not doing the things that bring me joy, my ability to do what you just explained is compromised.
Hmm.
And so it's an ongoing effort to make me first, right? To put my oxygen mask on before the grandmother jumps into her grandchildren's situations, right? If I
Hmm.
don't do that, I really can't, I lose my ability to be resilient. And
Hmm.
that's a choice. I have to be really clear. It's a choice. We only have so much energy, right? And if we choose to spend it over here versus over here, this may not be the healthiest choice, but it is a choice. And there are consequences to those choices and benefits to those choices, right? So if I can balance out my ability to give with my ability to make me a priority, it changes the way I view the world, and it changes my ability to adapt. And resiliency really is about adapting. It's about, the way I engage in the world, the way I choose to be, how I can bounce back when I have an unforeseen or unknown circumstance I find myself in.
Yeah.
And there's a lot about resiliency, right? I think it's about how are we emotionally flexible, right? When we're anxious, we tend to get more rigid because there's this illusion of control. If I can just move through life, if I can just narrow down when I agree to do things, when I engage, when I don't engage, my world is wonderful. But pretty soon, so like this is normally how we function. With somebody who's anxious, the world gets very, very small
Hmm.
and very narrow, which means I'm limiting my support system. I'm not doing those things that bring me joy. Because if I can control the outcome, if I can control the circumstances, then I'm happy. But that's an illusion, right? You can't control things. There's so much about our world that we can't control, that if I can be flexible, and that is not easy, but if I can be open to other possibilities, different ways of looking at things, it helps support resiliency.
Yeah. I agree like fully. When I've done my work, I then can also like do better in my
Mm-hmm.
relationships. But one thing I will say before we go into this is sometimes where people make a mistake is they expect their married partner or their relationship partner to be everything for them. There is not one person who's supposed to be
Mm-hmm.
everything for you.
Mm-hmm.
If anybody did that to you, it would
Mm-hmm.
exhaust you.
Mm-hmm.
You have to have a small, mix between whether it's some family members, your friends, and your spouse or your partner, that you mix up getting your needs met, putting all your needs. I mean, you also have to take care of yourself and you have your own reliability there. But I think sometimes that's where people's expectations or what they want to put on their partner, it's almost like they expect them to regulate them emotionally,
Mm-hmm.
or they start putting their fears and everything on their partner, making their
Mm-hmm.
partner
Mm-hmm.
responsible. And we need to make sure that we aren't ever putting all of our needs on any one person. It's an impossible task and it will literally kind of catch fire to a relationship.
Well, again, remember we talked about what drives anger,
Hmm.
things that seem unfair or injustices. And if I have unreasonable expectations for my partner, I'm forever disappointed, right? And
Hmm.
when I'm disappointed, I can feel shame and guilt and anger. And so, talking about, I say this when I work with couples, I think one of the driving factors for unhealthy relationships are unmet expectations. They're
Oh,
unmet because they're not talked about, right?
so
They're
true.
unsaid. And so when I get couples in session, we talk about, what are these reasonable expectations? What have I thought before, and where can we move to the middle where we compromise on expectations? And if we can do that, there's less anger and resentment, and we're building connections and trust. And that's what resiliency does. It builds trust and connection in a relationship. It allows me to say, um, I don't like what I just heard. Can you further explain? Rather than coming at it, somebody in an aggressive way. If I'm regulated, I can ask that question from a curious state, right? Being curious helps me diminish the anger, resentment, and frustration, the dysregulation. And
Mhm.
so if I can be curious, if I can talk about what is so meaningful to me and how this behavior affected me, you're speaking your truth. And when I speak my truth, I'm less angry, I'm less resentful, I'm less the victim. I can
Mhm.
really become my own person again. And that's the beauty of all this work, right? Is that we heal through that.
Mhm.
And I think speaking your truth improves communication with your partner, right? And as communication increases and improves, the trust and resiliency increases and improves in a relationship. Because if expectations aren't met, but I don't know what you expect of me, so how can I possibly meet them, right? It's a no-win circumstance for the person that you're with.
Mhm.
So being able to speak your truth and say, this is what I need, this is what I don't need. And maybe we don't always know what we need, but it's maybe sometimes easier to describe what I don't need. Either way, it's being
Mhm.
clear with your partner. And when I'm clearer, we have a healthier relationship overall. We're building trust, we're building, connection, and we're reducing conflict, which I think at the end of the day really matters.
Yes, and even talking about like expectations, your partner is different than you. You fell in love with them for who they are.
Mm-hmm.
Sometimes people think, well, I can fix them or I can alter this. No, no, you can't. You
Mm-hmm. It's
can't.
not our
You know,
jobs. Yeah.
we're also not supposed to try to mold our partner to exactly what we think we deserve and need. That is like not for us to even think and
Mm-hmm.
be like, that's not even an okay thought, in my opinion.
Mm-hmm.
um, to understand too that as you both have been slightly different, that's also how you learn how to compromise and find that middle ground. But
Mm-hmm.
also,
Mm-hmm.
if you're with the right partner, God paired you for a reason. And it's also to help you learn how to get fueled and work through things and help each other grow. And you're both supposed to do that for each other. And
Mm-hmm.
sometimes to say difficult things and also really
Mm-hmm.
wonderful things. It is a equal give and take,
Mm-hmm.
and I think sometimes people's expectations of their partner are way up here, but what they're giving are down here. And so
Mm-hmm.
you have to be objective also to what you're expecting or putting on other people. Are you remotely even
Mm-hmm.
doing that for others? Yeah.
Yeah, and with healthy expectations come healthy boundaries, right?
Hmm.
It's a point of strength in the relationship and confidence building, knowing that if we can feel safe with my partner
Hmm.
speaking my truth and knowing that the response is assertive as opposed to aggressive or dysregulated, if I can feel like my partner is a safe space, I feel better, the confidence in the relationship is better, and the ability to be healthier as two me's than making a we, it, it all is better. But if the two me's are not regulated, the couple is not regulated.
Hmm.
That's the individual work. And we are different, but differences are beautiful, right? Differences allow us to grow and learn in such different ways.
Hmm.
It would be really boring if you had two introverts together. They would never leave the house, right? Like that wouldn't be healthy. So it's nice that you can be with a partner that understands that sometimes we push and we pull, but at the end of the day, we're truthful and honest and have really good boundaries. That's resiliency.
Yeah.
Yeah.
So true.
Mm-hmm.
So, I also think sometimes when outside, and so we'll be wrapping up soon, but when outside situations occur, like let's say you have a spouse who has long term friends and they're really great, but their partner's not somebody who jives with you, or their partner crosses a lot of boundaries. Sometimes this is what's coming up for some people. I mean, it's come up before for me, but I'm noticing there's a theme for some women, and then it's like they want to tell their partner, well, you can still be friends with your friend, but then every time they go hang out with them, they get dysregulated. They start having issues. And I'm like, okay, that means you
Mm-hmm.
need to do work because you
Yep.
can't ask your spouse to stop being friends with a childhood friend just because their partner is really not so wonderful or causing you distress. Then there's certain boundaries you can make.
Mm-hmm.
You don't have to be included in other things. You know what I
Mm-hmm.
mean? Like you don't have to subject yourself to anything you don't want to, but we can't expect our spouses to start cutting people off just because we have certain things that we need to work through. That to me is very unfair.
Mm-hmm.
So it doesn't mean like, of course, you might want the spouse to have boundaries with that, person. But I think we just have to be respectful to sometimes there's going to be a
Mhm.
little bit of separation because of the way life circumstances have happened, and that
Mhm.
we can be okay with that. That doesn't mean our spouse is not choosing us. You know what I
But
mean?
if I have confidence, Teresa, I don't have that kind of reaction, right?
Yes.
And so part of speaking your truth is building confidence
Mm.
in knowing that I matter. Not because the person receives you in the way you want them to receive you. It really isn't about them when you speak your truth. It's about me. It's
Mhm.
all about me in that moment. And so when I speak my truth, I am being strong, I'm being confident, I'm being assertive and loving. And again, if that's who I say I am, then my behavior lines up. And there's an
Mhm.
example of that. If you're being triggered by somebody's boyfriend or girlfriend or whatever, you need to deal with what is triggering in me. Again, triggers show up because I need to address something. Is it an
Yes.
abandonment issue? Is it a rejection issue? Is it I'm not feeling confident within myself in that moment
Yeah.
to allow it to the relationship to occur and trust in my partner? So there's
Mhm.
all kinds of issues there for me. If it's triggering, we have to address it.
Absolutely. And I think too, like, it's important to let your partner, if there's something going on, it's important to let your partner go and address that with the person. Like, if that person keeps crossing boundaries, let's say with your husband or your partner in a way that's not good, if you feel the need to address it, then you address it. We
Hmm.
need to be able to let our
Hmm.
partners speak their truth and address situations. Again, that doesn't stop the fact that they can go hang out with them. You don't have to if you don't want to, right? But I do think sometimes, one of the people brought up was just that every time, he's going to go hang out with that friend, she was bringing up that was triggered. But again, this is a similar person who's dealing with abandonment issues.
Hmm.
So still, it's
Hmm.
like, then I need to go and find the help and the counseling so that I can figure out how to address this and heal.
Right, because when I'm dysregulated in that moment, it is negatively, in fact, impacting our relationship in that moment. And it's
Yeah.
not about what my partner is doing, it's about me. And I
Hmm.
have to deal with that individually. If I don't, you see how this just gets worse and worse, right? The relationship, the struggles, the conflict, the trust gets broken from a very distorted way. There are many
Hmm.
ways to handle people who are inappropriate. My way
Hmm.
may not be your way, may not be somebody else's way. As long as we understand what a healthy boundary looks like, people establish those in lots of different ways. Allowing your
Hmm.
partner to do it their way says, I trust you. And
Hmm.
and and it really is at that point it's about me, not about you. Again, it keeps going back to the same pause.
Yeah.
Hmm.
Yeah.
Hmm.
So I just thank you so
Oh, you're
much
so
for
welcome.
everything. It's always a blessing to have Margaret. There's just a lot of wisdom, a lot of experience. And as much as we can read about things online nowadays and get all the information we need, nothing compares to somebody who has the experience, right? Experience really supersedes the ability to cut the excess fat out of the way and get to the heart of things. So I really appreciate that.
Oh, thank you,
Yeah.
Teresa.
So thank you so much for joining us. We hope that the podcast always gives you tools, right, to set you free in life. We are really just coming so that you can gather
Hmm.
information, wisdom, and understanding and go get the good body work, the good counseling, the good resources that you need so you can live your best and happy life. As always, we speak life into you, speak life into yourself and others, and we hope you have a truly blessed day. Take care.